In this edition of Out and About with the Prime Minister, the nation's leader visits Mary Child's Hospital and the Cardin Home. The Prime Minister first stopped at Mary Child's, a 24-hour, 10-bedded facility manned by trained doctors, nurses, and auxiliary staff. The hospital provides inpatient and outpatient services to individuals from Keys to Sadlers. He was accompanied by Minister of Health, the Honorable Marcella Liebert, and the Ministry's Permanent Secretary, Andrew Skerritt.
Good morning.
Good morning.
How are you?
I'm okay. You okay?
All the best. How are you?
I'm okay. And you?
I am fine.
Okay. You look fine.
The Prime Minister, Minister Liebert, and the Permanent Secretary then engaged the staff with a discussion on the plans to upgrade the facility.
We are going to do some upgrades to this facility. The services which are at the moment rendered are of the best quality that we can provide in a facility of this kind. I make specific mention of best quality because we know that the providers of the services here are all of the best quality. Highly trained professional medical doctors. We have doctors like Dr. Udu, Dr. Alexander, and of course Dr. Vance Gilbert, who interact with the patients who come to this facility from time to time. But we also have support staff, especially nursing staff. Sister Jack is a highly trained professional, long-standing, and with the support staff that she has, I am very confident that the patients here receive services and support of the highest quality. She is supported by the auxiliary staff as well. And I want to commend, therefore, the auxiliary staff for the support that they provide to this institution. But we believe that we shall always endeavor to improve. The physical outlay of this facility has to be improved and will be improved.
This facility, as you heard and which you'll hear in greater detail from the Permanent Secretary, Mr. Skerritt, will be undergoing much needed changes, both in terms of the infrastructure and the upgrading of the services that it would provide. I want to make it clear that it would be an integrated facility similar to Poxel. I think we always think about putting the health center, which is just stone's throw away, as part of the total facility. But we also have to remember it will also have environmental aspect of it to it in terms of the integration, so that you have a one-stop shop, so to speak, in terms of the treatment, in terms of the primary care that the health center usually provides for the community and the surrounding communities, as we say, from Keys to Sadlers, and also the environmental aspect of it, which is extremely important because, as we always say, the state of our environment really in large measure determines the state of our health.
The Honorable Prime Minister and of course the Minister spoke about an integrated health facility, similar to what we see at Parkson Medical Center. And we thought about it very carefully and have put plans in place in the ministry to deliver just that. I'll look at the health center part, the primary health care, because what we'll have is the hospital and, of course, the health center under one roof. And what we plan for the primary health care. Of course, we'll deliver all the services, child health, immunization. We have an excellent EPI program in St. Kitts, which at least 98% coverage, and we intend to build on the successes that we've had with our extended program on immunization and have this right here in the facility when we include the primary health care with, of course, the secondary and tertiary health services. Doctors Clinic, we want to reduce incidence and prevent and control incidence of chronic non-communicable diseases, diabetes and hypertension, and we'll extend those services here right in this facility. Also women's health, which is a major issue. We of course are planning to have OBGYN services, which will include pap smears. That of course is significant in reducing incidence of some cancers, and we want to have those services right here. The minister spoke about environmental health. We will put our environmental health office right under in this facility so that we can help to inform, educate, reduce incidence of vector-borne diseases. There's a lot of talk about chikungunya out there. Of course, this is endemic right now in the Caribbean region. It is a small space, and St. Kitts is no different. However, I would like to advocate that source reduction is important, so persons would have to be responsible for ensuring that containers that can be filled with water that can breed mosquitoes are not on their properties. And of course, the ministry will continue to do its work, carrying out fogging, and of course, education and promotion with respect to reducing incidence of chikungunya. This is for the primary health care side. What I would also speak about is the services we intend to have on the hospital side of this facility. Of course, it will include a dental unit, like the one in Sandy Point. The ministry is committed to reducing incidence of oral diseases for oral health, reduce incidence of gum disease, and as well as dental caries. So we decided that it was important to replace or put back the dental unit here. So it have the western side covered, last year city center covered, and the eastern side of the country covered. Additionally, a 24-hour emergency medical service base. We speak about covering the entire island, and when we mapped out our services, we realized it's also important to put that base here as well as in Bastia and Sandy Point. So you would have also a 24-hour emergency medical services base here, right here at Mary Charles Hospital. Upgraded labor and delivery, that's important, and that is something we intend to do when we upgrade the facility. The Prime Minister spoke about radiological services, and we have to be able to provide some X-ray services here, which we intend to do if we are to make our emergency room here a modern and updated one. Also, blood tests. We are going to facilitate basic lab tests to provide instant lab results here.
The Prime Minister then visited the Cardin Home, which is one of the government-owned healthcare facilities that has been in existence for 87 years. Currently, there are 72 residents, 31 males and 41 females. He was welcomed warmly by the staff and subsequently sat down with them to discuss the future of the home.
At one end of the care facilities, you have our Joseph and France General Hospital with modern care support services, and at the lower end, at another end, I would say, not the lower end, but at another end, you have the Cardin Home, which provides care for those who are mainly social cases. not having any serious and acute medical conditions. If they do have medical conditions, they are chronic medical conditions and they are stabilized. But it's because of the social problems that they encounter outside in the community why they are brought here and looked after by the government. We would have had a lot of people who would normally be considered as beggars, no place to live, and they would have come here to live and to be cared for. But we've moved far away from that. And so, as I said, only a few now, in those specific conditions I mentioned, are actually here. Irrespective of why they are here, they have to be cared for. They have to be cared for with dignity. We have to ensure that their self-respect and self-esteem are in fact maintained. We expect them to be treated not just as human beings, but as persons who have a soul, who have needs, who have their own emotional challenges from time to time, and thus have to be responded to and cared for. It is with that background that I want to thank you who are providing the care for them here. Apart from thanking the Ministry of Health and the Ministry of Community and Social Development, headed by our minister here, for being responsible to a large extent, I want to thank you personally, as the Prime Minister, for the service that you provide to maintaining persons and providing care for them here in this facility.
We believe that nothing is static, and with time and use of premises, you would have wear and tear, and so you would need to constantly improve the facilities and the services that are provided, bearing in mind that this change is constant. And so I just want to say that we constantly monitor the situation in terms of the quality of care and the infrastructure. And at this current moment, the kitchen, the bathroom, especially on the male side, the roof are all in for repairs almost immediately. The materials to do those repairs are already on hand. So it's something that we've been preparing.
The Prime Minister did not leave out the residents at the home.
I used to teach you. Frederick? Yes, sir. Pay attention. Yes, sir.
Join us next time for Out and About with the Prime Minister.
Want to stay up to date with what's happening in St. Kitts and Nevis? How about a place where you can get all important links for the government ministries? What about facts on St. Kitts and Nevis? Search no more. sknis.info is a one-stop shop to find exactly what you're looking for and more. Our website also connects you to our social sites like Facebook, Twitter, YouTube, Flickr, and SoundCloud. Go ahead, visit www.sknis.info and start exploring.